felt she was getting acne around the chin area. And this is such a common question that's asked, and it's so tough because when we are, say, over the age of 35, you're dealing with anti-aging issues and then you're dealing with acne at the same time. A lot of acne treatments dry the skin out, and that's not good for anti-aging, because the first rule of anti-aging, well, the second rule actually, the first rule of anti-aging is always wear an SPF 50. The second rule of anti-aging is to always use a moisturiser, because if your skin's dehydrated, it will look, the lines, the wrinkles will look more obvious. So it's important to moisturise regularly for anti-aging purposes. So typically we get acne on our chin area because the chin is actually the fleshiest part of our body, and typically before a period or mid-cycle you'll find your chin more fluid, and that fluid gathers and can kind of block pores or help to block pores. What is acne? Acne is where we have pustules, which are the ones spots that you can squeeze, papules, which are the kind of hard red spots, and then blackheads and whiteheads. So there's 4 parts to acne. What happens when acne happens? Well, what happens is that we have pores on our skin, or they're called pilosebous units for fancy terms, and these are almost like cups. So to keep our skin looking and feeling good, we have something called sebum on our skin. So sebum is the oil which keeps the kind of skin ticking over, keeps the clock running on our skin. When our pores become filled with this sebum, what happens is the pore becomes blocked, bacteria gets trapped, you get the yellow kind of pustules, you can get red sore papules, those are the ones you can squeeze, and you can get open and closed comedones or blackheads and whiteheads as well. So the first thing to do is to look at what you're using in regards to makeup and with regards to cleansers and moisturisers. Never ever use scrubs on your skin. Physical scrubs, they don't work, they make everything worse. Never ever use toners when you have acne, because it dries your skin out, makes it irritated, and actually you make more sebum and you get more acne. Always use something to wash your skin with that's non-comedogenic, that's suitable for acne type skin. I love Elav's Skin Balancing Wash and Moisturiser. It's excellent, no parabens or preservative, but it's great for controlling the oil without stripping off all the oil off your skin as well. Or in the French pharmaceutical brands like Avène, Bioderma, Uriage, have anti-acne washes. Use a moisturiser. Use foundation is no problem, but use a non-oil based foundation. Go to your GP. Your GP can prescribe a topical treatment to use for your acne. We use something called Triclinic, which is excellent at night time. It's got retin in it, and clindamycin. And we take an oral antibiotic as well for acne. Go on this for 6 months. And again, it's prescription only from your GP. If this doesn't work, you can be referred to a hospital-based consultant dermatologist who can prescribe Roaccutane for you if it's needed. Again, that's only from a consultant. Don't take Roaccutane that belongs to your sister or your auntie or whoever. It's only to be prescribed by a hospital-based consultant dermatologist, because you need to be monitored while you're on it. But do go and do something about it. And typically, your treatment from your GP will work quite well for mild acne. And again, go to your local pharmacy. I know Care Plus Pharmacy cover Elav products and Uriage, and I know they have some Avène as well. So if you have a local Care Plus Pharmacy, they can provide you with that too. So I think we've another question in. Yeah.
Okay, so I'll just, yeah, thanks. So I never get spots, but I seem to every now and then get an underskin pimple on my chin. It feels quite like a boil. What is this?
Again, it sounds like acne. So on our chin, that tends to be the place we get this, what's called hormonal acne. So typically mid-cycle, you will get something you can squeeze, papules or pustules. If your face is shiny, if you find you're a little bit greasy, like I am, I get very shiny if my makeup starts sliding towards the end of the day. And I get, again, this kind of hormonal acne. It is acne. So again, looking at your cupboards, changing everything that you're using, as in your facial cleanser, no toners, no scrubs, but use a cleanser like the Skin Balancing of Elav with the moisturiser, and going to your GP and trying, just if it's a very isolated 1 or 2 spots, trying something like Triclinic gel, which you use on prescription only at night time, that can really help when you have a small, mild amount of acne as well. So it's worth giving that a try. Yep.
Okay, so Christine wants to know, how can a child of 11 use acne products, or are they too harsh?
Yeah, it's a great question, Christine. And I get asked this a lot as well. And again, because our girls, well, I'm assuming this is a girl, sorry, guys as well, they tend to have more hormone earlier. There's a couple of theories on this. Basically, there's one theory that our kids are so much healthier than we are, as in, their diet is better, for example. They have more, they eat more good proteins, good source of protein. So you'll find that girls are getting periods younger. I mean, I hear girls getting periods now at 8, 9, when the average maybe 20 or 30 years ago was the teens like 14, 15, 16. So actually, if you see acne coming in a 9 or 10-year-old girl, you know that kind of the Mr. Period is kind of coming along behind it as well. So it's very normal now for kids of 9, 10, 11 to get acne. And you're right, some acne treatments are not suitable. If you walk into the pharmacy, there's an array of treatments you can use. And a lot of these, if you have eczema, for example, or if you have sensitive skin, are not suitable. They strip your skin off completely of oils. And again, what your body does is says, oh, hang on a second, she's lost all her oil. I'm just going to give you some more oil on top of that. So stripping off with harsh products doesn't work. When I was a student nurse, we used to use things like alcohol wipes called Starets all over our face for the acne, and I can tell you the result was not good. So stripping off with alcohol-based products and witch hazel and Clearasil, no, don't use any of that. Again, the brands like Elav or the French pharmaceutical brands Avène and Uriage have an acne wash and a moisturiser that have no parabens, preservatives or any nasties in it, and they're soap-free, so they won't dry out the skin completely, but they will balance off the amount of sebum in the skin. So I would recommend going to the local pharmacy and asking for Elav skin balancing solution for this child, or Uriage or Avène, because their products are gentle, but they will balance off the acne. And in this age group, it tends to be quite mild. So something like a wash that's anti-acne will help. However, and it's a really important point to make, if the acne grumbles on, if it gets worse, do bring your child to the GP, who can prescribe, again, usually an oral antibiotic in combination with a topical treatment like Triclinic, which is clindamycin and Retin-A. When these are prescribed together, we don't get the resistance issue. But if you were on this treatment from your GP for 6 to 12 months, for example, and it's not working, then you can be referred to a hospital-based consultant dermatologist to look at something like isotretinoin under the care of a consultant. The literature, when we examine it regarding acne, tells us that the kids, because we live in an Instagram culture, and unfortunately teenagers believe that they're the only person who has acne, or that, particular boys can't even cover it up, and that this perfect skin somehow exists, which it doesn't. But certainly teenagers are under a lot more pressure than I was, for example, when I was a teenager, and, to look a certain way. And actually, acne can cause low mood and anxiety in itself. Acne can be treated. So do bring your child to your GP if they have acne, with a view, if the treatment from the GP isn't working, to go and see a hospital-based consultant dermatologist who can put you on a longer or a shorter term treatment that works quite well for acne. Because again, once the acne is treated, anxiety issues in children tend to kind of lift a little bit. So scars are very difficult to treat from acne, but acne can be treated. So I hope that helps.
So the next one comes in from Sheila. So I have psoriasis of the scalp and use Betnovate. Is there anything else I can use instead of this to stop the flakes and itch?
Scalp psoriasis is a nuisance. So psoriasis is a skin condition where we're making more skin effectively. So I get new skin every 6 weeks. When you have psoriasis, you get new skin every 3 days. But these skin cells are immature. So there tends to be redness, inflammation and flakiness, almost like a severe form of dandruff. And scalp psoriasis is difficult to treat because, say, for example, if I have psoriasis on my body, you can be referred to a dermatologist, and we can treat you with something called phototherapy light in-house in hospitals across the country. However, light or sunlight or fake light like phototherapy doesn't treat hair-bearing areas. So if you have a mop of hair, effectively, its light will not get rid of the psoriasis from there. The first port of call is to use a shampoo that's going to help reduce down the flakiness, as you say. So again, I always find Kappa's shampoo really, really good at keeping flakiness down and redness. The most important point, however, when using a medicated shampoo is you must wash wet your hair, apply the product and foam that product up. So work that product up as best you can, coming right down over the forehead area. put your timer on. So step out of the shower and leave it in contact with the scalp for 5 full minutes. That's 5 full minutes on the scalp. If you rinse the shampoo off immediately, it will not work. So leave it on for 5 minutes and then repeat. So rinse it out, apply it again, and another 5 minutes, leave it on, and then rinse it out. There's another product that we prescribe, which is prescription only, called Cocois. And anyone with psoriasis will be familiar with Cocois. It's a bit stinky, it's got coal tar in it, but it's excellent at reducing redness and flakiness. And again, it comes in a tube with a nozzle and prescription only. And you separate the hair every centimetre and put a line of Cocois all over the scalp. Leave it on for about an hour, put a shower cap on, and then rinse it out. And again, that's very effective. The problem is it's very time consuming. But if you use Cocois for a couple of days in a row, it will kind of get on top of the psoriasis and then maintain with your Capicil or your Betnevate topically as well. Again, if your scalp psoriasis becomes bad to a point where you find you have a little bit of hair loss or it's really creeping down your face, go to your GP and ask for a referral to a hospital-based consultant dermatologist in your region. Because, if the scalp psoriasis is severe, you can have hair loss, which is reversible, but we can use treatments like oral medications and injectable drugs. Again, usually these are only reserved for moderate to severe psoriasis, but if your scalp psoriasis is severe, it is an option for you to use. And go along to Irish Skin Foundation, that's www.irishskinfoundation.ie or www.britishassociationofdermatologists.co.uk. There's some great information there on psoriasis, including scalp psoriasis and its treatments and how to do them.
Okay, so when a pimple has a head, should I pop it? I'm very curious about that too.
Oh, this is it's awful hard not to resist, isn't it? And I think... I'm not a fan of the Dr. Pimple Popper because the name itself suggests that that's something you should do. And you know what? We were talking about depression and acne there as well. And I seen a game that came out last Christmas and it was where you squeeze out like a piece of plastic and it's like squeezing spots, basically. It's kind of like breaking bubble wrap as well, isn't it? Or, there's something kind of tactile in it that's good. No, you shouldn't squeeze your spots. Is the answer to the question. You shouldn't squeeze your spots because inevitably, if you could squeeze a spot just to kind of get rid of the pustule, but I've never squeezed a spot where you just get rid of the pustule where you don't have blood coming up behind it. And the problem is when you squeeze a spot and there's blood, you create, you can get a bacterial infection from that, and also you create a scar. So you're disrupting the pitycebus unit, you're spreading this P. acnes, which is the bacteria involved in acne, across the area. So, if you get an acne spot, you tend to get maybe 3 in a row or 4 in a row. That's where the P. acnes has spread. And also you get destruction of this pitycebus unit. And then you get those red scars that are left behind. Or you can even induce, if you're squeezing a spot, you can induce keloid scarring, or you can induce almost like the chickenpox scarring, those ice pick scars you get with acne. So it's definitely not a good idea to squeeze spots, although it's very tempting. So treat the acne. Again, go and look at the ELAV skin balancing solution, look at the Uriage, I think it's called Hysic, and look at the Aven cleanse range. For your wash and your moisturiser, no toners, no physical scrubby dubbies. They're not suitable for acne skin at all. Don't go getting loads of facials either because that doesn't help. Get yourself down to your GP who can give you a proper prescription for acne that's going to work for you. And if that doesn't work, then you can be seen by a consultant dermatologist who will give you another step-up treatment for your acne. So don't squeeze those spots. Yeah, it's not a good idea.
Okay, so this is the last one from David Cooper. So my wife got a chemical burn on her hand years ago. It flares up during the summer and becomes very dry along with broken skin. She's tried urea cream. Have you got any other suggestions?
Urea cream is great for something like keratosis pilaris, where you get the kind of bumpy skin up bilateral arms or on your thighs, because urea can break down the keratin and normalise the skin. For something like a burn or an old chemical burn, first of all, it'd be very important to this delicate skin to always ensure that you're in a factor 50 over the skin, because if there was a skin graft in place there, for example, skin grafting makes... So basically skin grafting, where you take a piece of skin from another part of your body and you stick it on to another area. So again, it's never the same skin skin, it never looks the same. So using SPF 50 on that, really, really important. Hand protection. So I think this is the hand, he said, wasn't it, where they got burnt? So using cotton gloves at night time is really, really important. So cotton gloves and rubber gloves for doing wet work at home. And at night time then, applying a moisturiser and popping on the cotton gloves, and that will help repair the skin overnight. I would highly recommend that she only washes her hands using Elav hand soap, because there's no soap in it. It looks like a normal soap dispenser. There's no soap in it. It won't dry out her hands. I would use a really lipidy, nourishing moisturiser as well. There is a great one. I wouldn't use urea, and I wouldn't use anything with salicylic acid in it. I wouldn't use anything with active ingredient. There's a one by Bioderma called Cecibio. And it's a nourishing moisturiser. Uriage have a version as well. Aven have a version. So go to your local Kippers Pharmacy, do all these French pharmaceutical brands, or your local pharmacy, and go and ask for whatever French pharmaceutical brands. We're talking Aven, La Roche-Posay, Uriage, Bioderma, and they have products that are healing products. So basically they're moisturisers that feel really lipidy and really fatty, and but they're very comfortable. And using something like this, it spreads easier and it's more hydrating than something with a kind of another active ingredient in it, for example. So your shopping list is your Elav hand wash only, cotton gloves, buy 2 or 3 pairs, you can wash them in the washing machine, and when you're doing wet work, use the rubber gloves on top. At night time, use copious amounts of whatever French pharmaceutical nice healing cream you can get your hands on. Cover the hands in it and pop the cotton gloves over. Hop into bed and you can peel them off in the morning, and you'll find the skin is repaired and nourished and feels a little bit nicer as well. So I hope that information helps. So thank you so much, and the questions are wonderful. Thank you again.